I'm Amy Irvin. Welcome to Out to Lunch. Each year, the U.S. Patent and Trademark Office grants hundreds of thousands of patents to people who embody what we sometimes refer to as American ingenuity. These are folks who are creative problem solvers, capable of out-of-the-box thinking that leads to innovation. From Thomas Edison to Steve Jobs, American ingenuity has resulted in a host of innovations and inventions that most of us now take for granted. I'm thinking, of course, of modern electricity and personal computers, but also smartphones and, let's face it, artificial intelligence. Our healthcare system has also benefited from American ingenuity, too. In the last 50 years, medical advances in diagnostics and imaging and biotechnology and genetics have revolutionized healthcare, leading to improved treatments, enhanced patient experience, better public health, and greater efficiency and cost savings. Perhaps the most obvious benefit of American ingenuity in healthcare is that Americans and people living around the globe are just living longer, healthier lives. My lunch guests today, Dr. Blake Williamson and Dr. Lawrence Salone, are both contributing to this universal progress with their individual insight and innovation. Dr. Blake Williamson is the president and managing partner of Williamson Eye Center, a vertically integrated ophthalmology practice combining optometry and ophthalmology to provide comprehensive eye care from pediatrics to retirement age. Founded more than 80 years ago by Blake's grandfather, Williamson Eye Center has grown significantly over the past decade, operating one of the highest volume eye surgery centers in Louisiana. This center is often among the first practices in the world to access new eye care technologies. For instance, Dr. Williamson was the first surgeon in the world to implant the Odyssey lens, a breakthrough cataract implant. Dr. Williamson, welcome to Out to Lunch.
Thanks for having me. How you doing?
Pretty good, thank you.
I'm happy to be here. What a beautiful setting. This is great.
Thank you for
Thanks
joining us.
for the invite.
After serving in the military, including a deployment in Iraq, Dr. Lawrence Salone, founder and CEO of PTI, returned to Baton Rouge where he became acutely aware of the lack of accessible mental health services and the high rate of suicide among service members. In 2012, Dr. Salone launched Post Trauma Institute, a Louisiana-based mental health organization offering integrated psychiatric services under one umbrella, including medication management, psychological testing, therapy, and substance abuse treatment. An early adopter of virtual mental health care, PTI has been offering telehealth services since 2014, well before telehealth became mainstream. Today, PTI employs 5 prescribers and 7 therapists, offering services to veterans, National Guard members, and reservists, as well as a growing roster of employers concerned about absenteeism, burnout, and productivity. Dr. Lawrence Salone, welcome to Out to Lunch.
Welcome. Thank you for having me.
Blake, Williamson Eye Center sees some 120,000 clinic visits and performs approximately 7,000 surgeries per year, earning the reputation of operating one of the highest volume eye surgery centers in Louisiana. Additionally, the practice regularly teaches other surgeons internationally and adopts new lasers and devices well before they reach larger markets like New York or Los Angeles. By all measures, Williamson Eye Center is very successful. But you'd think a clinic this innovative and cutting edge would be in a bigger city like New York or Miami. Is there something about the business climate in Baton Rouge that keeps you here?
Yeah, I think that a lot of people have that misconception that you have to be in a large metropolitan area in order to access the best care, the best physicians, the best technology. At least in our space in ophthalmology, what we find is that the surgeons that generally have access to devices and lenses and lasers early are the ones that perform a lot of surgery. So let's say one doctor performs, let's just easy math, 100 surgeries a year, and another surgeon performs 2,000 surgeries a year. The industry that makes these lasers and lenses are obviously going to go to the one that does 2,000 a year because they have a chance to do, to see how their product performs on a larger value, and it powers their studies more. The more patients you have in a study, the N number, number of patients increase, the power of the study increases, and that makes it more translatable. You can say, you know what, this lens, because we tried it in 2,000 people and it worked really well, we're more confident than just 100 people. And so as a result, rural areas, usually the ones that are enrolling the highest volume of patients and doing more surgery. Also, a place like New York or Miami, you throw a rock, you're going to hit an ophthalmologist, right? Well, not so in a place like Baton Rouge. There's just not that, frankly, there's just not enough of us to take care of the volume of cataract patients that are out there. So it's a little counterintuitive, but usually more rural areas are performing more surgery and therefore are more connected with industry and are therefore more innovative. They're on the vanguard of new technologies.
Lawrence, as I mentioned in the opening, PTI began offering telehealth services in 2014, long before Zoom or Google Meet made it possible for us to socialize or do business over our computers. Today, telehealth is an integral part of healthcare system, and increasingly, so is artificial intelligence. So, given that you were on the cutting edge of mental health delivery, I'm assuming you still are. So I'm wondering, what is that relationship between mental health care and AI? Is there a place for AI in the delivery of mental health care?
Absolutely. So when you look at being innovative in this space, keep in mind that medicines in our space hadn't changed over 100 years. So when you see a tool like telehealth introduced into the community, it's a game changer. Now, there's a lot of hype and discussion around AI and what's its fit. I don't believe we're at a place right now where AI can replace physicians and therapists. What I believe AI can augment a doctor's office or a practice is in streamlining the things that take a lot of time, particularly for those organizations that don't take insurance or need to take insurance. AI is a game changer because it never sleeps, it doesn't call in and so forth. And you, in essence, program it to do the things that you need done, those repetitive tasks. And so dictating notes, making sure that what we say in this visit is charted the appropriate way so that individuals can get the maximum amount of reimbursement, which is an issue in our space. So what I see in the next 60 months, the next 5 years, AI is just going to be heavily integrated into our space to help clinicians deal with the sheer volume. And when I say sheer volume, we're seeing unprecedented levels of anxiety. People are self-isolating. They're dealing with chronic stress, primarily dealing with money, and they're having proper consumption. And when you have those three things together, anxiety goes through the roof, and there are not enough people to deal with that as it states. So AI is going to allow people to give their very best to more people. So I see it as a game changer.
Blake, are you also using AI at your practice, and how so?
Pretty routinely. Lawrence already referred to our number one use right now is in our billing department. So we have tons of different codes that we use to sort of label different eye diseases and different surgical procedures. It can be quite laborious trying to match that up. AI has helped us with that. The other thing it's helped us with is sort of virtual scribing. So, when I walk in a patient's room, a lot of times when you go to a doctor's office, the first thing you have, the doctor comes in and they turn their back to you and they're like on a computer. That's awful. I'm not doing that. I'm like, no, I'm going to walk in. I'm going to look at the patient and act like I'm bumping into them at lunch or at a coffee shop and try to provide an experience, right? Well, I can do that because I have a scribe with me who's typing everything I'm saying. Well, AI has helped us eliminate that to some degree. So some of our providers are using AI scribes that listens to the whole conversation, creates the note for you, so you don't have to have a scribe there physically doing it. So I think that it's wonderful for that. And then lastly, I would say it's so good at pattern recognition. So retina photos, cornea imaging, things like that, you can take a picture and put it in there and say, what is this? This is something unique. What should I be thinking of? What's the differential diagnosis? I used to have to carry books, for that, and now you can do it, just with your smartphone.
Well, of course, the worry among the average worker, or someone like myself even, as a radio host, is that AI is going to replace employees. Are you envisioning different roles for staff within your practices in the event that AI sort of takes over what would be a traditional office assistant's role?
Yes and no. So pre-pandemic, we have a rather large practice, and our front office staff was 10, 15 folks. What we learned is you're never going to get away from that person-to-person interaction. And so much like what Blake said, is if we can get some of the routine things done, it frees up the time. I don't see an environment where you're just going to walk in like you do at some fast food restaurants and you just go punch a button and your food's prepared for you. I don't see that environment. Maybe in the next 50 years, 30 years best, but I don't see that as a possibility. What we've been able to do from an organizational standpoint is improve the quality of life for the employees that we do have. So if we reduce a position from 15 folks to 5, we've been able to give them benefits like 100% health care, which is huge for some of your lower compensated individuals in this space. That's a game changer. And we're able to do that because the technology allows us to scale. You have a rather large organization. Scaling is important. You're doing 20,000 surgeries a year. I don't want to say liability, but the cost factor of employing a bunch of folks is through the roof. And so what I've seen organizations do, I know what we've been able to do is to go in and use the technology where appropriate and really deliver on quality of life, things that are pertinent to our missions and vision statement to the people that are there. And we've been able to retain employees. And that is a game changer because, quite honest, some of our front office individuals, they interface with the patient more so than the providers do. And that is key in today when how we feel matters.
Yeah, I mean, I would agree. I think that if you're doing something, if you have an employee or a teammate that is doing something that is task oriented, a repetitive task, then yes, maybe AI would replace that, such as looking up billing codes. Right?
Correct.
But chances are they didn't want to do that task anyway. Right. And so someone's got to be in control of that and overseeing to make sure that they did it right. I think that if you're task oriented or what you're doing as a task, maybe you're in trouble. But if you are experience oriented, if you are service oriented, if your job involves interfacing with another human being, okay, I think you're safe. I really do. So I'm more optimistic, that AI is going to, support us, in all that we're doing, and that we should really harness it, because I don't think that people are looking into going to see an eye doctor and interfacing with a screen, robot style that's like telling them what's going on. I really don't think that. I think they want that human touch, human experience. And so if you can be in an industry that's doing that, I really do think that you're safe.
Yeah, it's more of these soft skills perhaps that in the past weren't as important in some respects, but in an age of AI are going to be increasingly important, the things that a computer are not able to do. But both of you have identified finding talent is a challenge for your practices. So are you looking outside of the Baton Rouge area for new employees and recruiting them? How are you convincing them to come to Baton Rouge?
Well, for us, we're up to 9 locations now. So we've been around for 80 years, and I have 9 locations. I have 227 employees, and we're just now expanding to Lafayette, which is another 47 employees. We're just doing an acquisition there. And so we're massive, in sort of our reach. And I would say that people are coming in to Baton Rouge.
They want to work
an
with
hour
you.
away. Yeah. So to them, this is the big city, and so it's not difficult finding someone in Slaughter, in Donaldsonville, who are happy to drive into Baton Rouge because they've been doing that forever, and perhaps their parents were as well. So we're kind of a hub and spoke model. So for us, we haven't had to look outside the state, the region, or even locally within about an hour's drive for our talent base.
And what we've experienced, going back to when we first started, you overpaid for folks to come in, and that was challenging. As it stands today, we've partnered with educational facilities, so when folks when they're in training, they can either do their postdoc with us or they do training with us and so forth. Finding talent is more about fit and culture. So we have to weather some of the storms we've weathered with the pandemic and the floods and economic changes and so forth. It really boils down to culture. And so what we've earned the right to do is to I would say that we are an emerging employer in the state of Louisiana. And so what we've been able to do is let that culture precede us. And so finding talent, there are a lot of folks that want a job. There are a lot of people coming out of school that are qualified what you're looking for to sustain 80 years of growth and so forth is culture. Because if you are putting that patient first, if they're trusting you with their life, their thought process, or their career goals and so forth, if you do that at a high level, you're going to grow, you're going to expand. They become baby commercials talking about who you are, and we see the same thing happening on a on an employer-employee side.
Mm-hmm. Staying along with that theme, Blake, your practice was started nearly 80 years ago. How have you seen the culture of your practice changed?
Yeah, well, my grandfather started 80 years ago. He had 4 sons, all 4 of them went in ophthalmology. And then I'm a 3rd generation. So we like to joke that we're a very non-creative family. We just keep doing the same shit over and over. I don't know if I can say that word or not. So we keep doing the same stuff over and over. But we like it. We're good at it, and it really transforms people's lives. When you think about eye surgery, most of what we do in healthcare, medicine is restorative. You're taking someone who's sick and making them healthy. What we do in eye care, and especially specifically vision correction like LASIK, ICL, cataract surgery, what we do is not just restorative, it's transformative.
Mm-hmm.
In many cases, it's making someone better than they've ever been, right? And so, that is sort of the tip of what we provide. And it's the most important thing in our culture. So everyone that's there, has been on that wavelength since the beginning. My grandfather was entrepreneurial. He had multiple locations, decades and decades ago. And my dad and all my uncles were also doing a lot of the same things I was, which was early adoption, new technology, being the first to introduce X, Y, and Z device or surgical procedure to the community, because we really want to portray that, if you want cutting edge, you're going to come to Williamson. And so that culture has always been there. The main thing that I have seen change in the past decade since I've been there, first of all, we've doubled in growth in the past 10 years, doubled the locations, the employees, the surgical procedures, all that, because, I kind of had a chip on my shoulder. When I came there, it was already in place, and I didn't want to just be the doctor's son who kind of coasts. And, I've always had that chip on my shoulder that I was born in a good position. I was born on 3rd base, and I'm very, aware of that. And in fact, that's what motivates me. So for me, I wanted to work hard to do it better than my dad and my granddad, to try to grow the practice even more. So I think that, that the main thing that we have done to do that is have non-Williamsons own Williamson. So for years, it was just 100% owned by my dad. And I thought for true growth to happen, you need to have other surgeons who own a piece of this, right? Mm-hmm. Who have real skin in the game. That way you can continue to build and once they are an owner of the practice, they're way more motivated to see more patients, do more surgery, grow the locations, take on financial risk, all those things. And so opening it up so non-family members can own a percentage of our business has been the main culture thing that's changed in my tenure.
Well, that's very exciting. Are you also moving towards a model where employees will have part of ownership of the clinic?
No, because the in general the vast majority of what we earn is through actual surgery, right? And so the surgeons themselves are the ones that generally own surgery centers. And there are some Stark laws and anti-kickback statutes and legal reasons for that, but in general, most surgery centers are owned by the surgeons themselves.
Mm-hmm.
Well, let me add to that. So as we are looking at expansion beyond the state of Louisiana, some of the laws that he mentioned laws, some of the things that you have to deal with and what people don't see on the healthcare side, it'd be challenging in some states and some communities where non-physicians can own a physician practice and so forth. And a lot of that's rooted in transparency. I want to piggyback on something you said. You said that you moved from a hub and spoke to more of an I don't want to say investment model, but you've opened up the ownership. How have you maintained the culture? Because in my experience, there are individuals that are motivated. You're motivated by honoring the family name, and I can respect that, right? My father was in business. That's kind of how I cut my teeth in business. But how are you ensuring that they maintain their culture beyond the P&L, beyond the financial side of that? Because the good book says a good name is better than silver and gold, and you guys have a great name. So how are you ensuring that over the last 10 years?
Well, the biggest thing is we've been very selective. So
Okay.
there are currently 2 non-Williamsons that own a piece of Williamson, and there's one more that's about to make partner as well.
Okay.
So we watch them for at least the first 2 or 3 years. So in their contract, when they start on with us, they don't have an opportunity to buy in for the first few years.
So they have to earn it.
They have to earn it.
Oh,
And once I
love it.
believe it and I've seen it and it's for real, then I feel very confident in offering them a piece of it. And also there is, things in the contract that, God forbid, there was to be a change in their personality, right? And they were to start to damage our culture, that we are able to move on,
Right.
Free of litigation. And so I call it a jerk clause. So, if you start acting like a jerk, you don't get to live in
Shotgun
this
clause
house anymore.
Right.
Yeah, pretty much.
Okay.
But we don't expect to ever have to do that. I mean, our partners, they're my brothers now, and they talk the same language. They feel the same way.
Because we're using the word culture, but it's really your reputation that's on the line as well. That has you've built 80 years in building. So, Lawrence, Pizza Guy is also in a growth mode.
Oh yeah.
You have plans to continue the virtual telehealth model across the state, but also you're reaching and wanting to build relationships with corporate entities here in
Right.
Baton Rouge and across the state as well.
Across the country, really.
And so why are you moving from what started out as services for veterans and National Guard reservists to folks that are working in a corporate setting?
So, looking back, when we started out, we wanted to serve veterans. I mean, I saw firsthand what the transition back into civilian life did to folks. Within the first year, we had to expand beyond just focusing on veterans because the need is there. 50% of every community is dealing with mental illness. That means 50% of employers, 50% of cities, 50% of churches, 50% of the people in this room statistically are going to be dealing with mental illness, and there are no viable answers, right? When you start looking at a lot of my research, a lot of my area of focus is on performance. So if a kid's not doing well in school, their performance, is challenged. They come and see us, we test, and we may have a medical intervention, so forth. When you start looking at the impacts on the economy, when you start looking at the $6.3 trillion cost that mental health hits our economy, and this is pre-pandemic. We're still looking at the data, and understanding what actually happened during the pandemic, but $6.3 trillion hit our economy before the pandemic. And so when you take the data that says 50% of every community, yes, people are gonna come in off the streets or so forth into the organization, but what happens in the company? How many, what a lot of consulting that I've done, we've been able to help take companies from losses to back to double-digit net income by simply addressing mental illness. When you look at the data that says our part of healthcare has a 7-fold increase on the cost of healthcare, what that means in simplistic terms is if you fix everything from the neck up, then things get better. Well, why can't that be the case in corporate America? And, as a business owner, as an entrepreneur, I understand, what it means to make payroll. What does it mean to, how do you workforce develop and so forth? And you can't do any of that without behavioral health, mental health. And so that is something that we've been doing for the last decade, focusing on that. And we've seen some tremendous things happen. A lot of the instruments that I've created and used around the country is centered around how do we identify it? There's a shortage of behavioral health providers. And the reality of it is, so that environment is rich with opportunity to help people.
Well, certainly it's also the case that if you are working for a Fortune 500 company, you probably have pretty good insurance, because one of the issues that you've both identified is the low reimbursement for the services that you provide.
Let me say this. I'm gonna speak for the behavioral health side. 80% of people that have employer-based insurances cannot use their insurance to get behavioral health care. So in our community in Louisiana, we see these numbers echoed across the country. There's 12-month wait just to get a new patient appointment for behavioral health care. Whether that's medicine, whether that's therapy, testing, that's unacceptable. So yes, we have insurance. It's really not about the reimbursement. It's really about, can we create a system that's going to get people access to care?
Yeah, I was telling Lawrence before, I mean, I've had in my own family members who needed mental health services and couldn't get them. You know, it doesn't matter. Even if you have money, you can pay cash out of pocket. You know, it's like you're still waiting months.
Yeah.
You know, when you need to see someone, it's pretty wild.
And if you have a family member, a loved one, a spouse, an employee that's going through it, and they have to wait a month, they have to wait 12 months, that's just not acceptable.
Blake and Lawrence, the U.S. healthcare system is rapidly changing, driven by escalating costs, technological integration, and evolving policies affecting insurance. Despite these challenges, your approach to innovation will ensure your respective practices continue to provide affordable and accessible healthcare to our Baton Rouge community. For a mid-sized city in the South, the presence of PTI and the Williamson Eye Center are two of the reasons we're punching way above our weight in healthcare here in Baton Rouge. Thank you for everything you're doing for the city, for our health, and thank you both for joining me today on Out to Lunch.
Thank you for having me.
Thank you.
My guests today on Out to Lunch have been Dr. Lawrence Salone, founder and CEO of PTI, and Dr. Blake Williamson, president and managing partner of Williamson Eye Center. We edited this show to fit into our time slot here on WRKF. You can hear our unedited conversation and find out more about Dr. Salone and Dr. Williamson on the Out to Lunch Baton Rouge podcast. You can find and subscribe to the Out to Lunch Baton Rouge podcast on your podcast app and on our website, itsbatonrouge.com. If you want to know what we look like, you can find photos from this show on itsbatonrouge.com and on our Out to Lunch Baton Rouge social media. These photos were taken by Ian Lito and Miranda Alvarez. You can find more of Ian and Miranda's photos at albalitomedia.com and at albalitomedia on all socials. Out to Lunch is a production of INO Broadcasting for itsbatonrouge.com and WRKF 89.3 FM. The producer of our show is Grant Morris. Our technical producer is Eric Merle. Our associate producers are Peter Raschuti and Ann Edelman. Our researcher is Holly Dutchman. Today's show was engineered by JT O'Neill. I'm Amy Irvin. Thank you for joining me. I look forward to meeting you again next week around the lunch table for more business, Baton Rouge style, on Out to Lunch.